Oh, my head.
In stage 1, the tumor is less than 2 inches big and has not spread to any surrounding tissue. Stage 2, the tumor may have grown to larger than 2 inches. It may have spread to the lymph nodes, and it can have spread to the chest wall, the diaphragm, the pleura, and the main bronchus. In stage 3, the tumor is continuing to grow. It may have spread to other lymph nodes in the body, and it may have spread to other nearby organs such as the stomach or the liver. In stage 4, the cancer may have spread throughout the lung. It may also have spread to the other lung and continue to spread to other parts of the body such as the brain or bone.
In order to diagnose someone with lung cancer, image testing is used, and an X-ray image of your lungs may reveal an abnormal mass or nodule. A CT scan can reveal small lesions in your lung that might not be detected on an X-ray. Septum cytology is when you place a sample of septum under a microscope to check for lung cancer cells. Tissue sample biopsy is also used, and bronchoscopiology checks to see if there are abnormal areas in your lungs. And mediastinoscopy is when incision is made at the base of your neck and surgical tools are inserted behind your breastbone to take tissue samples from lymph nodes. Needle biopsy is when a doctor uses X-ray or CT images to guide a needle through your chest wall and into the lung tissue to collect suspicious cells. A biopsy sample may be taken from lymph nodes or other areas where cancer has spread, such as your liver.
For lung cancer treatment, there are 3 commonly used drugs. The first of these drugs is known as bevacizumab, or otherwise known by its trade name Avastin. This is an angiogenesis inhibitor made via a specially cloned antibody that targets VEGF-A, or vascular endothelial growth factor A, and inhibits the creation and repair of vasculature to the cancer cells. Without the constant stream of nutrition and necessary resources and stimulation brought in via that vasculature, the cancer cells cannot grow, or at least as rapidly. The second option is erlotinib, otherwise known by its trade name Tarceva. This is an EGFRI, or epidermal growth factor receptor inhibitor. It works by affecting the tyrosine kinase receptors that are excessively active inside of the cancer cells. By blocking the ATP binding sites on these receptors, erlotinib is able to inhibit the signals that begin the transduction cascade that eventually results in cancer cell division and growth. The final option is known as crizotinib, or better known by its trade name Xalkori. This drug works by inhibiting the activation and fusion of several receptors, namely ELM4 and ALK, whose activity leads to rapid growth and cell division, and promoting the more malignant characteristics of the cancer, such as growing out of control and living far longer than normal cells.
There are 3 common therapies used in treating lung cancer. The first and most common therapy is chemotherapy, which is a form of drug treatment administered by mouth or intravenously. Chemotherapy may increase the effectiveness of radiation treatment when both are used congruently. The second type of therapy is radiation therapy. This is primarily given via external beam radiation. Radiation is developed for each patient based on their cancer stage and the patient's overall health. Generally, treatments may be given in combination with surgery and chemotherapy. The third form of therapy is surgery. Surgery is most commonly used when treating non-small cell lung cancer that has not spread outside of the chest. The surgery is performed by removing the tumor and a margin of surrounding healthy tissue. There are multiple procedures for performing surgery, some as vast as removing a full lobe of one lung, or minimally invasive procedures used to diagnose and treat lung cancer by assessing the chest through small incisions.